Alright, we're going to go on to some male and female anatomy disorders in this particular module. So for the women, we ended up the last module on menopause, and so now I want to talk to you about some menstrual disorders. So the first one is amenorrhea. So I say amen. Woohoo! Okay, so that's the way I remember it. So this is when you don't get a menstrual period. It can be due to physical abnormalities of reproductive structure, stress, excessive athleticism, or extreme weight loss. So I will share a personal tidbit about myself. I had this for a very long time. So when you're younger, like 20s and all, it's very common for women's menstrual cycles to be like not regular. And so I've always been pretty athletic. I go to the gym all the time, I run all the time. And so I think that my body composition, it maybe has like a little bit more muscle on it, and when my fat was down, then I wouldn't get a menstrual period. But as you guys know, I had 5 babies. So after the last baby, gained a little bit of weight each baby, so after the last baby is when my period finally started to regulate. So the reason why I'm sharing this with you is because I don't want you to think that if your menstrual period is not regular, then you can't get a baby. I can tell you definitely I was extremely fertile, even though I never got a period. Amen, right? And then also I've had other friends that are definitely same thing, amenorrhea. So sometimes doctors say that we have to have a menstrual period. I don't know about that. And so they'll actually give you the birth control pill as a way to regulate your menstrual period. There can be problems like, I don't know if you guys know the reality show. It was called Survivor. It was like one of the first major reality shows. But I don't know if you guys would ever think about this, but like, why didn't they get their periods? It's because what happens is when we're stressed or our weight goes way down, a lot of times we get this amenorrhea. So stress can be a role in it, extreme weight loss. So maybe you want to go get checked out if you don't get a regular menstrual cycle, but I'm trying to tell you that it's very common for women not to get their menstrual period all the time, and whether or not you decide to take the pill to get a regular one, I'm not sure, because a lot of the new birth controls, like you go for months without a menstrual period. Anyway, that's what I have to say about amenorrhea. Okay, let's go to dysmenorrhea. Okay, so dysmenorrhea is an actual disorder. So some women, when they menstruate, the pain is so intense. They cannot get out of bed. It is like, I'm going to guess it feels like what labor pains feel like. And those are pretty terrible. So, it's just kind of like each one of us has a different body composition. The muscle in our uterus is affected differently. And so this is definitely a recognized menstrual cycle disorder, a doctor's note. It can be debilitating, and I think your textbook has ways to deal with menstrual pain that they talk about, but I know that I've had females in my classes saying, I just wish someone understood. So I hope that some of you can understand. Those of you that don't get any menstrual pain, it's different for everybody, and heat down there can help, taking aspirin, pain medicine, but I just want to get across that this is definitely something that can happen to people, dysmenorrhea. Okay, PMS, premenstrual syndrome. Okay, so again, I keep reinforcing the same thing, is every woman seems to be different. So some of us get PMS symptoms and others of us do not. So I can tell you about 10 days before my period, I get really, really grouchy. So when they say, oh, she's on the rag, I don't know if you guys use that term anymore. I'm not really grouchy during my menstrual period, but I know that there's like a for me, the 10 days before, like there's like one day where I am just like on fire. And it's not that I feel bad, it's not that I'm in pain. I don't know, just some kind of hormonal shift that I'm just meaner on that day. And it's like, ooh, what is that? Okay, but every woman has a different cycle symptom. Some will say, I don't get anything. Some will say, I'm grouchy on my period, I'm grouchy a few days. Another thing is the sex drive. So you'll hear that women will tell you they have different feelings about sex at different times of their cycle. And so some women will say, oh yes, I really want to have sex right before my period, or I get really like I want to have sex on my period. So we talked about that, you know, it's not harmful to have sex on your menstrual period. It's just like a little bit messy. Okay, so I'm going to go on to the next slide now. Okay. All right, let's talk about breast cancer. So breast cancer is the second leading cancer killer in women after lung cancer. So we're going to find out that prostate cancer for men is the same thing. Okay, so the causes are unclear, but here are some risk factors. Prolonged exposure to estrogen. So the more fat that you have on your body, your fat cells actually release estrogen. So we're going to find out that exercise has been found to reduce the risk, and they think because there's less estrogen from the fat cells. So if you had early menstruation, which means that you started your cycle before 12, or if you had late menopause, which is after 50, genetics, it runs in the family, higher amount of fat, heavy drinking of alcohol. So I think alcohol has something to do with estrogen production as well. I should know that, but I can't remember it. The link is in my brain, but I just can't think of it right now. Okay, so the earliest detection yields the greatest survival rate. So I believe that I have a breast exam video after this. And I think it's really important that we do notice the changes in our breast, because when you catch it early, you can just fix it, but you don't want it to spread to the rest of the body. Okay, so yes, we're going to see a breast exam, but I'm going to go on to the male disorders now. So the first one is prostatitis, and this is inflammation of the prostate gland, and it's easily treated. It's treated with antibiotics. So young men can get this. So anytime, ladies, gentlemen, anytime that you see a man that he has urinary frequency, a little bit of lower back pain, it can disrupt sexual functioning. I think you need to recognize that this might be prostate problems, because this is where men have problems, is the prostate, and a lot of men are not educated about this, and so sometimes the women in their life have to recognize this. And especially for young men, why would you suffer with this? It's just an antibiotic. You can take care of this. So you say, well, how would I get it? So I guess if you rattle that prostate a lot, like on a motorcycle for long rides or really heavy machinery where it's rattled, that can inflame it. There's certain like bacteria in shellfish that can inflame it. So you just go to the doctors and ask for antibiotic. Okay. The next one is prostate cancer. So men are supposed to get a prostate exam after 40, and we saw that you have to go in through the anus. They have to palpitate the prostate gland. So that's, I think a lot of men don't really like that. I don't think I would really like that, so I'm sorry for you guys. But anyway, prostate cancer. Okay, so there's many different types of treatment. You can do radiation, surgery, they can give you drugs, androgen suppression therapy, and so now they can actually do a blood test. So they usually do the prostate gland, which is the finger exam. I think it's called digit exam. The digit exam, and then if they find an abnormality, they can do a blood test, or if they suspect it, they can do a blood test and it can tell you. So just like the breast cancer, you want to get that treated right away so it does not spread. Okay, let's go on to the next one, benign prostate hyperplasia. It's called BPH. So what happens as men age is their prostate grows, and sometimes their prostate can grow so much that it actually puts pressure on the urethra that's going through there, and then from the seminal vesicles it's running through there. Remember, the vas deferens comes up and it runs in there. So that when it grows so much, it can put pressure there, and it can cause sexual dysfunctioning, it can cause urination problems. So they can go in and just remove part of the prostate so that it doesn't cause those problems anymore. Okay, so again, the similar symptoms are lower back pain, urinary frequency, and painful ejaculation. I think that's something that I really, really want to push here, so please take note of that. Just recognize, oh, if I'm having these symptoms, it's probably a prostate problem. I should go get that checked out right away. Okay, here's some other male disorders. So we have urethritis, which is bladder inflammation, urinary frequency, burning during urination. So both men and women can get this. So if you have a bladder infection, it's usually got burning, and this one, again, you can cure it with antibiotics. People recommend drinking cranberry juice to keep the pH balance in there all taken care of. So we also can get cancer of the testes, and this is detected by a testicular exam. So if you feel like bump on your testicle, then this is something that you should get checked out. However, I do want to say that I've heard many men mistake the epididymis for a bump on their testes. If you remember, I told you that the testicles develop inside the abdomen, and sometimes they don't drop. And so this is what cryptorchidism is. And what happens is if they're born and their testicle is up in the abdomen, that seems to be associated with a higher risk of testicular cancer. Okay, so we're going to see a testicular exam in our next video. But now what I'd like to do is I'd like to finish up with these last couple disorders, which is priapism and Peyronie's disease. So priapism is when you have an inability to decrease an erection. So this happens in the porn industry. A lot of times they inject drugs into their penis to help them hold their erection. And then what will happen is the blood flow can't go out, and you need the blood flow in the penis to circulate so that the tissue doesn't die. So if the tissue inside of the penis is not getting the right oxygen, it can actually die, and that's what gangrene is, death of the tissue. So there's a question on your test that says the penis can get gangrene. Yes, it can. Also, sickle cell anemia. This is when the blood cells are shaped a different way, and so sometimes the blood can't get in and out of the penis, and this can cause tissue death as well. Another thing that can cause priapism is diseases of the spinal cord or drugs. Okay, our final disease that we're going over right now is Peyronie's disease. And I've had so many men tell me in class, like, hey, I'm so glad you went over that because I have a minor form of that and I didn't know what it was. Is it dangerous? So a minor form is so common. Don't feel bad about it. But these ones that I'm going to show you a picture of, now these are the crazy ones. Okay, right? So minor forms, so a lot of men, their penises curve. And as long as it's not as crazy as the one that I'm going to show you in a few minutes, then there shouldn't be a problem. So what happens is there's fibrous tissue around the penis. Remember I showed you that? And sometimes it like creates a curve. But now I'm going to show you some ones that are debilitating. And what's sad about this disease is like they don't understand it. They don't understand it. So sometimes the scar tissue can happen like quickly, like almost overnight. And then it can suddenly disappear overnight too. And they don't really have much of a cure. In extreme cases, they can do some surgery. They talk about vitamin E, but we just don't understand why is the scar tissue developing. So check this out. So this one is probably okay, safe here. because this one could still work. But this one, how are you going to have sex with that and then it not hurt you? And so as you can see, it can be pretty extreme. So abnormal curvature of the penis, very little understanding, no reliable treatment. Okay, so what we're going to do is we're going to watch our breast exam and our testicular exam, and then I'm going to come back and I'm going to go over these last anatomy quiz questions.